There are many more things that HealthLinc does that a private practice simply wouldn't be able to do.
We understand that our mission is to the community at large. It is to serve people who have alternatives but want good quality health care.
There continues to be a need for what we're doing, and we're getting a lot of attention as being the future of healthcare.
It's everything. It's medical, it's dental, we're going to have optometry, we have mental health,
obstetrics, a family practice, we have internal medicine, pediatrics.
It's treating the whole patient, not just one part of that patient.
We make it so that everyone in our communities can afford and can get high quality care.
It's the main reason that I'm here is because I just feel like I'm giving back to the community.
It was an opportunity for me to express my belief that it was unacceptable in our community that people did not have access to primary health care.
You have an opportunity here to help people that otherwise wouldn't have it. And just to be the person that gets to do that is pretty exciting.
So if you want to have that kind of experience where you really make a difference, this is the place to be.
Working for community health actually is the best way to go for a new grad or a student.
There's also a loan repayment program. A lot of people coming out of school have a lot of loans to pay back. So there's a big opportunity there.
For a new dentist, HealthLinc is a great place to begin. It's a great way to just focus on practicing the dentistry and improving it to be the best dentist you can be.
I do feel like I've become a better leader working here because they give us so much autonomy. It gives you the confidence that you need.
Everything at the end of the day, I still get to do or still practice with my own scope of practice and do what I need or do what I feel with the patient. I still have my independence.
Coming into a community health center as a newer dentist, they already have a patient base set for you, and as soon as you get here, you're free to start practicing. You don't have to try to develop that patient base because it's already here.
So I've never felt like I've been limited in what I could and couldn't do here at HealthLinc.
We are here to take care of everyone in the community, for the underinsured, the insured, the no insured at all. It is affordable. We provide the same care consistently at a great price.
We have several people who come here, they're insured or they're business owners and they don't have insurance, but they also believe in what we're doing.
It's a big variety from, uninsured, Medicare, Medicaid, private insurance. Lots of them just come because of the reputation that we have, because of the care that we give.
And they use us as their general practitioner as well. And we've had them for years and years.
We think of our community as the patients we serve no matter where they live.
Our culture here is really to be a part of a team. Having that group and those teams together that can actually make you feel better and help you and have someone that you can go to.
Even from day one, I just felt like I was a part of the family.
Nurse practitioners are educated to be team players, and that is what we do here. We work as a team to care for our patients.
You can talk to physicians if a patient has diabetes or they have high blood pressure. You can discuss their treatment with them as well, which is very helpful when you're young and learning how to practice.
We discuss how we can take care of patients. We decide on the best ways to take care of patients. And at the same time, there is an atmosphere in which we can challenge each other.
Being surrounded by people that also have a desire to learn and to increase in their knowledge base and give patients the best possible care just kind of works off each other. We sharpen each other.
It's just an open environment. And if I have a question, another provider's right there to answer it, and it's open. You don't feel like, I have nobody to ask, you're by yourself, I'm lonely. No, none of that.
It is combination, both the medical that I will provide the care and then coming from the psychology point of view. In combination, it really works very well, and I couldn't be any happier.
It's been a great experience. I've enjoyed every bit of it.
Working here is a lot of fun, especially because you have people who actually are very caring, compassionate, dedicated to what they're doing here.
We're surrounded by a smart, great team of people, which makes my life a lot easier as dental manager. That's an important part about any job that you accept, is liking the area where you're going.
The location of HealthLinc, Valpo, is a really good location.
We have universities, Valparaiso University, we have Notre Dame.
You have the dunes, you have the beaches.
We're real close to Chicago.
Of course, the lakes. You have Michigan nearby. It's only 15 minutes away.
We have a new park downtown. We have, restaurants.
We have a lot of really good restaurants downtown.
Valparaiso just keeps getting nicer.
My favorite reason for being here is just the people I work with on a daily basis.
It is really a great feeling that can provide care to those patients and not be restricted.
I really enjoy working with the Spanish-speaking patients. We have a fairly large pediatric population too, so I really like seeing kids.
It's always something new. It's always something exciting. Whether it's a patient, whether it's the staff, whether it's the other doctors, it's new every day.
If you're a new dentist coming out of school, there's nothing better than working at a community health center like HealthLinc. They give you great experience. There's more autonomy to do what you want, and you feel best for the patient. And I think that's very unique.
Knowing the difference that you have in a patient's life, and it just makes you want to stay here.
It always comes back to the same thing. The favorite thing about working here are the patients. I'm gonna tear up. To be able to see that smile on their face and put that smile on their face is something that you can't beat it. It's great.
You got to be inspired about what you're doing, and you got to be passionate about what you're doing. And it's a learning experience from day one to you retire.
The best moment is when someone comes who has not been able to get their problems addressed, who feels that no one is listening. And they arrive here and they say, finally, somebody cares. Finally, somebody is going to take me seriously and try to help me with this.
We have a dream, and that dream is that there will be high quality, affordable health care for everyone. If you want to be an innovator, to make a difference in healthcare and be on the leading edge of healthcare, this is the place for you to come to work.
This is an opportunity to be an innovator. This is an opportunity to shape and engage the future of medicine in this country.
We're the healthcare reform that everyone is wishing and hoping that they can be too.
Healthcare for everyone. Humane, effective, and affordable.